sir. My name is Kaylee. I'm going to be your student nurse for today, okay?
Okay.
Can you go ahead and tell me your name and date of birth?
Jeff Sturt, 10/10/89.
All right, thank you. I'm going to go ahead and wash my hands and close the curtain for privacy. Your doctor's ordered a number of different assessments that he wants me to go ahead and do for you. So I'm going to start with listening to your heart, listening to your lung sounds, doing a neuro exam, head, ears, eyes, nose, throat, that kind of thing, and checking your range of motion and your gait and balance. Is that okay?
Okay.
All right, so I'm going to go ahead and listen to your heart sounds, okay?
Okay.
Do you take any medication for your heart rhythm?
I do not.
Do you have any chest pain or anything like that?
No, ma'am.
Okay. So I'm going to start in the second intercostal muscle on the right side, right next to the sternum, listening to the aortic. Moving right over, staying in the second intercostal to the pulmonic. Okay, moving down to the third intercostal, listening to the Erb's point. Moving down to the fourth intercostal for tricuspid. Moving down to the fifth and midclavicular for the mitral. Okay, I did not hear any type of murmur, good steady heart sounds, okay? Do you take any medication for do you have like any lung disease, asthma?
I have mild asthma.
You do have mild asthma. What do you take for that?
Symbicort and Allegra.
Okay, when's the last time you took it?
This morning.
All right. Any wheezing that you've noticed lately?
No, ma'am.
Okay. So I'm going to start in the right upper lobe. Take a deep breath in for me. Breathe out. Left upper, breathe in. Left lower. And right lower. Okay, and I'll listen in the axillary. Right side, breathe in. And left side. Breathe in. Okay. And go ahead and lean forward for me. Listening to the right upper posterior. Breathe in. Left upper. Breathe in. Left lower. And right lower. All right, thank you. Go ahead and lay on back. Lungs sound clear in all quadrants, all lobes. I didn't hear any wheezing or anything like that, okay? And I noticed during your vital signs that your respirations, I got about 12, okay? Don't see any labor breathing or anything. So now I'm gonna go ahead and assess your upper and lower extremities for any edema. And probably do a range of motion with that as well, okay?
Okay.
All right. So first I'm assessing for any edema. Checking capillary refill. Okay. Making sure that it's less than 3 seconds. Checking for edema and capillary refill. Okay, and that looks good. So what I'm going to do for your range of motion, do you have any elbow injuries, any joint pain with your elbows or wrist?
No, ma'am.
No? Okay. So I'm just going to hold your elbow.
Okay.
And just flex your arm, making sure I don't feel any cracking, popping, anything like that. Did that hurt at all?
No.
Okay. Do the same thing with your wrist. Popping, cracking, nothing, no pain. Same thing with this arm. I'm gonna go ahead and flex. I don't feel anything. Great. And with your elbow, with your wrist, sorry. Okay, no pain with that as well?
No, ma'am.
All right. And when I finish this, I'm going to go ahead and show you how to use the incentive spirometer, okay?
Okay.
Pull your legs out. We're going to go ahead and check for any edema in your lower extremities. Check your posterior tibialis. Make sure your pulses are equal on both sides. And they are. Check your pedal pulses. Got about a 2 on those. Good blood flow, good feed through. Equal on both sides. And go ahead and checking for edema. I don't see any edema. I'm going to go ahead and check your range of motion in your knees. Any knee injuries?
No, ma'am.
Knee pain at all?
No, ma'am.
Okay. So what I'm going to do is just pull it up, extend your knee, and good. I don't feel any popping or any cracking in that one. Same thing on this side. No popping, no cracking. And I'm going to go ahead and check your ankles as well, okay?
Okay.
So bring your foot up. All right. Okay. Same with this one. All right. And go ahead and apply pressure in the opposite direction with your feet, please. Okay. And same thing with your arms. All right. Good. Let me go ahead and show you how to use that incentive spirometer real quick, okay?
Okay.
So this is just to get expand your lung function. So what you're gonna do is this little piece over here is the goal that the doctor wants you to meet. So you're gonna press your lips on here and take a deep inhale and try to get this little ball up to where that little goal is, and try to hold it for about 10 seconds, okay?
Okay.
All right, thank you. Okay, now I'm gonna go ahead and do your neuro exam. Can you tell me your name
Jeff Sturg,
and what time it is? Is it?
8:15ish.
Okay, and what brought you in today?
Just a checkup.
Okay, and do you know who our president is right now?
Donald Trump.
Okay, so you're A&O times 4. I'm gonna go ahead and put on my gloves and assess your head. Can you go ahead? Yeah, just remove that. I'm just gonna palpate it for any masses, deformities, any bony prominences, anything like that, okay? Any head injury?
No, ma'am.
Any recent headaches?
No, ma'am.
Okay, so don't see anything, don't feel anything there. Your head size is normocephalic. I'm gonna go ahead and look at your ears, making sure that they're in line, they're symmetrical, and I don't see any issues with that. While I'm here, I'm gonna go ahead and inspect your ear, okay? Do you have any ringing in your ear, any, a lot of cerumen or anything like that?
No, ma'am.
Okay, just gonna inspect your ear. Looks clear. And this one looks clear as well. Okay, now I'm gonna go ahead and assess your eyes. I'm looking for perla, checking your pupils, making sure that they're equally reactive to light. Right now, your pupils are about a 4. So I'm gonna shine the light in your right eye, and this one should constrict 100%, while your left eye constricts about 50. That's called direct and consensual constriction, okay?
Okay.
So look straight ahead. Okay. And this one. All right, and I did note equal change with both of them. I didn't see any redness in of the whites, the sclera of your eyes. I don't see any discharge, anything like that. Do you wear glasses or contacts?
I do.
Okay, and you have contacts in?
I do.
Okay, when's your last eye exam?
About a year ago.
Okay, so now I'm gonna go ahead and assess your nose. Just looking at it, it's in correct proximity. Have you had any nose damage, broken
No.
nose or anything? Okay, do you have any difficulty breathing through your nose?
No, ma'am.
Okay, go ahead and close one nostril for me. Breathe in. Okay, and the opposite. All right. Now I'm going to assess your mouth. Can you go ahead and open for me? Looking at your oral mucosa is pink and moist. Good dentition. So everything looks good there. You see your dentist regularly?
I do.
Okay. So I'm also going to go ahead and assess your throat, okay? So first I'm going to check for jugular vein distension. Look to your right. Okay, and I don't note any on that side. To your left. All right. Now, here's a glass of water. Have you had any difficulty swallowing with anything?
No, ma'am.
Okay, so go ahead and take a few sips for me. I'm gonna just make sure. All right, I don't feel anything to note with that. So go ahead, I'm gonna check your gait and balance now, okay?
Okay.
Go ahead and stand up for me. Alright, so first I'm going to have you close your eyes for 20 seconds. I'm going to have my hands right here to catch you if you do start to sway too much.
Okay.
So just go ahead and close your eyes for me. Okay, great job. I didn't see any swaying. So now what I need you to do is just walk in a straight line, heel to toe, okay? All right, thank you. You can go ahead and have a seat. I don't see any swaying. I don't see any loss of balance. So everything looks good there. Do you have any questions for me?
No, ma'am.
Also, the last thing I'm going to do is just express where your different pulses are. So your carotid would be up here. Your brachial is going to be right here. Radial, of course, is right here. Femoral is right in here. Popliteal is going to be right here behind the kneecap. And posterior tibialis is down here on the ankles on both sides. Okay, now do you have any questions for me?
No, ma'am.
All right, I'll have the doctor in shortly, okay?
Thank you.
Thank you.